Hi everybody, I'm Keya. I'm one of the senior charges in the consultant-led unit here in NHS Fife. I've been asked to speak a little bit about how things have changed over the past year during COVID and for International Day of the Midwife, just to bring everything together, because the theme this year is data and how things have changed. So at the beginning of the pandemic, or just a month before the start of the pandemic, I got seconded into the role of clinical educator. Now in midwifery we do have a lot of face-to-face training. We need it not only to keep us upskilled, but we need it for our registration. So it's really important in midwifery that we have that face-to-face contact, that we have that upskilling in place. And when COVID started, it became really evident quite quickly that this wasn't going to be around for just 4 weeks, 8 weeks, 12 weeks, that this was here for the long haul. So we had to really think on our feet as to how we could develop training and bring it more to an online platform so that it was still readily available, even though we couldn't manage to see each other face to face for education purposes. So I remember doing a big mind map and thinking about how we could utilise online and virtual learning platforms. So in NHS Fife we had the quick rollout of Microsoft Teams. I'm sure you're well versed for that. And at that point we then started to think, how can we use this to our advantage? So it was a massive shift for us in maternity. We're very social butterflies. We're all used to sitting kind of together and working through things face to face. So it was really difficult to try and get that right and that balance right. So we had a look and thought, we had to get everybody signed up onto Teams. So that was a massive thing. We had over 200 midwives that we had to get logged in and familiarise themselves with how it would run. We then had to think about what presenters we could and what topics we could run virtually. So not everything can be run virtually, but what we could run, we would run, and we would make a promise with that. We then had to think about presenters, changing presenting styles, and do a lot of background work with that as well. So there was a massive amount of shift and a lot of work went into then getting our virtual programmes for education up and running. So as I said, it's really important in midwifery that we do this not only for patient care to make sure everything is safe and we're providing a safe management plan of care for all our patients in our service, but also for our registration. So we're looking at things like upskilling with infant feeding, upskilling with neonatal life support, and doing all this in a virtual platform was a right shift for us. However, one of the positives is that the feedback that we've received has actually been really great. A lot of the midwives are finding actually it's really easy to log in from home and have that quick upskill and being able to just dip in and out of learning as they need it and as they feel they require it. So a lot of positives have come from that shift. We're starting to remobilise some of the learning face-to-face with obviously enhanced COVID measures in place, because there's certain kind of governance and safety governance that we need when we're talking about maternity services and the skills that we need. But actually moving forward, we will still be utilising quite a lot of the virtual platforms, because actually the feedback's been really positive, and then we'll just be supplementing that with face-to-face training as we need it and as it's safe to do it. So I'm really proud of all the midwives who have just embraced the change and who have really helped this become a success. The buy-in has been great, and everybody's really worked hard to get their, and still been so committed to their lifelong learning and keeping themselves upskilled. So thank you very much, and we hope to continue in the future with more of a blended approach. So thank you.